Hello guys, I am Dr. Chami, sports physiotherapist. Today we will talk about exercise-associated muscle cramp. EAMCs are painful involuntary contractions of skeletal muscle during or after exercise. They are the most common heat-related illness and affect recreationally active individuals and competitive athletes alike. It presents as localized muscle cramping that happens spasmodically in different exercising muscle groups, usually the gastrocnemius, hamstrings, or quadriceps. The gastrocnemius is the most commonly affected. Clinically, EAMC may be recognized by acute pain, stiffness, visible bulging or knotting of the muscle, and possible soreness that can occur suddenly with no warning and last for several days. Common thinking, even among professionals, is that cramps are caused by dehydration and electrolyte imbalances. Unfortunately, these assumptions are incorrect and do not hold up to scientific scrutiny. It has been noted that cramping occurs more often in hot, humid environments. Conversely, EAMC have also occurred in cool or even cold environments. Dehydration. One of the most common beliefs is that cramps occur in athletes who are dehydrated. The problem is this theory is false. Studies looking at hydrated versus dehydrated athletes show no difference in rates of cramping. Prehydrating in hypohydrated athletes before games does not prevent cramps. Dehydration affects the whole body, yet it is often the working muscles, for example, calves, hamstrings, that develop EAMCs. If EAMCs were caused by dehydration or electrolyte imbalance, we would observe random muscles cramping. Electrolyte imbalance due to excessive sweating. Sweating is hypotonic, resulting in elevated serum electrolyte levels. Drinking excessive amounts of free water will lower serum electrolytes, but neither group has an increased incidence of EAMC. It was observed that both mild and severe hyperhydration with moderate electrolyte losses did not alter cramp susceptibility when fatigue and exercise intensity were controlled. Thus, the hypothesis of a direct relationship between dehydration and muscle cramping was not supported. So what is the cause of EAMCs? More recent evidence suggests that EAMC may be mediated by muscle fatigue that altered neuromuscular control. During sports competition, training, and a variety of other intense physical activities, repeated or extended loading on selected muscles can lead to localized muscle fatigue. The altered neuromuscular control theory suggests that muscle fatigue disrupts the normal functioning of peripheral muscle receptors, causing an increase in excitatory afferent activity within the muscle spindle and a decrease in inhibitory afferent activity within the Golgi tendon organ, both of which then lead to an increase in alpha motor neuron discharge to the muscle fibers, producing a localized muscle cramp. The potential risk factors associated with overload and fatigue-related muscle cramping also include older age, poor stretching habits, insufficient conditioning, cramping history, excessive exercise intensity and duration, and related metabolic disturbances. Why you cramp? Muscle fatigue is likely the cause. Treat the cause and not the symptoms.